we're going to go straight into hear from the Minister. He has recorded words that he would like to share with us. So if you just all give me a moment, I'm going to bring that up and we'll just have a moment to listen to what he had to say.
Firstly, I would like to welcome all today's webinar participants and to thank Barry Cullen of Dún Laoghaire Rathdown Task Force for the invitation to speak. I am aware that there are a broad range of agencies attending and presenting today. They include representatives from the statutory sector, HSE Social Inclusion, Addiction Services, TUSLA, the Ombudsman for Children, Barnardo's, Drug and Alcohol Task Forces, Community and Voluntary Sector, and Family and Additional Support Services. At the outset, I would like to take this opportunity to acknowledge the commitment and leadership of the HSE Addiction Services and Drug and Alcohol Task Forces during COVID-19, particularly in relation to the continuation of services and the adaptation of services. In 2019, the Department of Health provided funding for 14 strategic health initiatives which are delivered by local and regional drug and alcohol task forces in conjunction with the HSE community healthcare organisations. I am pleased to note that Bray and Dún Laoghaire task forces, in conjunction with Community Healthcare East, received funding for a targeted strategic health initiative to develop and support hidden harm interventions for children and young people. I understand that this initiative will provide supports and interventions for families in cases where children have been impacted by the substance misuse of their parents and or carers. It should also contribute to the enactment of the hidden harm framework across Bray and Dún Laoghaire and potentially across all the CHO region and help embed the approach within relevant services. And I am sure you will learn more about it today. I am very encouraged by the cross-sectoral collaboration between Bray and Dún Laoghaire task forces, Community Healthcare East and TUSLA in driving this initiative on hidden harm. Reducing harm, supporting recovery recognises that children living with parental problems, substance use, are more likely to experience mental health problems, academic underachievement, have poor social skills, and be more prone to developing substance misuse problems themselves later in life. The strategy commits to mitigating the risk and reduce the impact of parental substance misuse on babies and young children by building awareness of the hidden harm of parental substance misuse with the aim of increasing responsiveness to affected children. A key achievement under reducing harm, supporting recovery, on addressing hidden harm was a collaboration between the HSE and TUSLA, which resulted in the launch of the HSE TUSLA Hidden Harm Strategic Statement and Hidden Harm Practice Guide 2 years ago. This was subsequently followed up by an e-learning programme to support staff from both organisations to enhance their cooperation and response to the needs of children affected by parental problem alcohol and other drug use. And I am confident that today's webinar will make a valuable contribution to exploring the impacts and solutions to hidden harm and in sharing those insights with communities across the country. As alcohol remains the most consumed substance in Ireland, with an apparent increase in drinking due to the COVID-19 pandemic, it is vital to include a component on education and prevention for young people in this area. In line with the Government, we need to build on new evidence-based initiatives in this sector and resource harm reduction and education campaigns. Officials in the Department of Health and myself have been working on the development of a funding programme of 500,000 to support new evidence-based programmes, and it is intended that this programme will address key areas of need, including community education and problem alcohol use prevention, and details of the new programme and the application process will be announced shortly. We also hope to build on the work of the Community Action on Alcohol Project, CAAP, and aim to further assist task forces in developing coordinated strategies to change behaviour around alcohol and to raise awareness of alcohol-related harm. And in addition, proposals could also be aimed at furthering developments in line with the Public Health Alcohol Bill. In the context of the impact of COVID-19, I must mention the HSE Drugs and Alcohol Helpline, which is a confidential service that has both a free phone helpline and an email support service. I understand that the service has seen an increase in communications over the past year, particularly since March 2020. And I am pleased to inform you that the Department of Health is working closely with the HSE to develop the programme for government commitment on the establishment of a 24-hour helpline to provide advice and assistance to people who use drugs and their family members. It is based on the Frank helpline in the UK, and I secured funding of $170,000 in budget 2021 for this purpose. I should point out that the department has commenced a mid-term review of the actions in the National Drug Strategy. The review provides an opportunity to reflect on progress in implementing the strategy from 2017 to 2020 and any new issues that have arisen, including the impact of COVID-19. Several issues have been raised during the review, including hidden harm and alcohol, to name but a few. And when the review is finalised, I will bring it to government for approval. I envisage that the publication of the review and supporting documents will follow soon thereafter. Today's webinar coincides with the launch of a briefing paper on hidden harm and COVID-19, compiled by Alcohol Action Ireland. I welcome the launch of this briefing paper and look forward to gaining insights into the current difficulties being faced by children and their families in relation to hidden harm and alcohol misuse, particularly in the context of the COVID-19 pandemic. As Minister with responsibility for the National Drug Strategy, I am personally committed to ensuring that the National Drug Strategy is relevant and appropriate to address the societal challenges arising from the use of drugs, especially for children and young people, and for those all at greatest risk of harm. I am confident that a partnership approach across government departments and agencies, in association with the community and voluntary sector, will ensure that a comprehensive response can be offered to children and families. I would like to praise you all for the collaborative approach being adopted in tackling this shared goal of reducing harm in our society, especially during these challenging times. Thank you to the groups here today for your tireless work and focus on prevention, early intervention and support for children and families affected by parental problems, alcohol and drug use. A special thank you again to Alcohol Action Ireland and the Drug and Alcohol Task Forces, along with TUSLA and the other organisations involved in preparing or participating in today's webinar. And I hope you find this a learning experience and look forward to the session and afterwards to reading the report.